So this is the fiducial marker placement portion of the SpaceOAR procedure. They'll typically start with placing 3 or 4 fiducial markers into the prostate. And as we said in the last video, that's how they target the prostate for radiation treatment. So the doctor will usually tell you which side they want to place the markers on. Otherwise, you can just ask them and they'll say something like, I want to do, one on the left base. So the first thing you want to do is turn the probe to the patient's left side. So you're seeing the left side. You don't want to ever place markers into the urethra. So we're always going to do either left or right, away from urethra. So you don't want to see urethra. If you do, you have to angle away from it, because obviously you don't want to put a marker into the urethra. So you turn the probe to the patient's side. So remember, it's reversed because the patient's facing us. So their left side is over here on our right, and their right side is on our left. So just think of it as you're going to point the sagittal crystal. Remember, that's the one that runs along the top of the probe. You're going to point it to whatever side the doctor wants to place the marker on. So say they're doing left base, you're going to turn to the left, or they'll turn if they're using the stepper, and they're going to lock the probe in place. So you can see there's no urethra. And then they're going to come in with the needle. There's going to be a needle that they use. They're going to insert it about a centimeter above the probe. And you can tell them to do that. You don't want them to come in too close to the crystal because they might hit the crystal. So come in a centimeter above or a centimeter and a half above the probe. And then as they're coming in, you can see they don't really see the needle. So they can either move the needle left and right or turn the probe as they're coming in. You can see like I'm kind of showing up right here. And the idea is, like I said before, is to keep the sagittal crystal under the needle. So if they're not under the needle, they're not going to see the needle tip. And they want to be able to see the needle tip so that they can gauge where they're at in the prostate. So you can see the needle now. I'm in the apex. As I push it further, I'm in the mid, and now I'm going toward base. So they're going to put it in the part that they want to place it. So in this case, the left base. And usually, though, they will ask you to switch to axial, and then they'll step out. And what they're doing is they're looking for that needle. So you can see, just by stepping out, I'm not even rotating the probe because I know I'm centered under the needle already because I had the needle over that sagittal crystal. You can see that white dot right here. That's the needle. So sometimes they'll go in until it goes away. So you can see it went away, then just come back slightly, and that tells you where the tip is. So if they ask you to help find the tip, that's what you do. You go in until you don't see the white needle, and then just come back slightly. That first speck that you see is the tip. They can wiggle the needle around. See the needle here? Like it's wiggling it around. And what they do is they want to make sure, okay, we're in prostate. You don't want to be like right on the edge of the prostate. You want to be in the prostate. So if, say they're on the edge, they can pull back on the needle and then redirect it more medial and put it into the actual tissue. You want it to be kind of seated in the tissue. So once they confirm that they're in prostate and they're not too lateral, they may have you go back to sagittal, and they'll usually deploy it on sagittal. So they'll want to see the tip of the needle. So you just step in, or they'll step in until they see the tip. And then you'll see that they pull the internal stylet out on the needle, and it leaves that marker placement, and they pull the needle out, and they may ask you to spin the probe to see if the marker was placed correctly, or they might turn the probe using the stepper. So they're going to spin left and right. So you can see the probe right now spinning left and right, and they're going to try to visualize that white spot. There obviously is no marker here. I'm just using a phantom, but you can just pretend like that was the white marker there. They just want to see it and make sure, okay, yep, it's actually deployed. And so then they'll say, okay, let's go to the other side, maybe midgland. So you're going to turn the other side. Again, you don't want to see urethra. So if you see urethra, keep going away from urethra. And they may do this with the stepper themselves, which is honestly easier for us. So they're going to go to the other side. They're going to lock it. Same concept. They're going to bring the needle about a centimeter above, and you can tell them, try to, instead of inserting it midline, insert it to the side that they want to put it on. So either the right or left side. That way they'll see the needle easier. Because remember, that crystal now is turned this way, so it's facing over here. So if they insert here, they're not going to see it. So you gotta tell them, don't insert the needle on midline, insert it off to the side that you're trying to visualize. And then you'll notice that by doing that, they'll see the needle a lot easier. So if they're not seeing the tip, they're just gonna turn the probe slightly till they visualize that tip. And this is difficult when I'm holding the camera with one hand and trying to turn the other hand. So you can see that needle moving here. So they're a little bit too far. They want to go to the mid. So they're going to come back. You can see right here. So now you can see the needle well. And they can always turn the needle left and right in the gland. And when you see the lines like that, see how there's like a mirror image? That's actually a good artifact. That's telling you that you're right above the sagittal crystal. So if the doctor says, like, what's all that, noise or shadowing, that's actually a good sign. That means they're right over that sagittal crystal. You can see how well you can see the needle. So they're going to pull back to the mid-gland area, and then same thing. They're going to switch plane to sagittal. They're going to have you step out, and again, don't spin the probe, because if you spin the probe, you're going to lose the needle. You're already centered under the needle. So you just come back until they see the needle. So here, if it's too lateral, they're going to come back, go a little bit more anterior. Yep, now I'm in the tissue. See that artifact again? Because I'm right over that axial crystal. I'm centered right over it. That's good. And then they're going to have you go back to, be careful of that. See how I just hit that? That's what I don't like about this button. It's right next to this button, which changes the direction. So be careful of that. If it does, you got to flip it back, because what that's doing is it's flipping the image on you. So then go in again. Remember, when we go sagittal, we step in. Axial, we step out. So, things are moving on me because I'm using one hand to do everything, but it should still be in the mid-gland area. And then they're going to deploy it. They're going to take the needle out, and then they're going to spin the probe, or ask you to spin it left and right to be able to visualize that marker. So you're just going to spin slightly, just slightly, not a lot, and see that marker. And then they're going to do the third one, which is usually going to be somewhere else, like maybe right apex. So same thing, you're going to angle the probe to the other side, the right side, go to the apex on the screen, lock it in place. Or with the stepper, it's a little bit easier because it almost self-locks the way that it works. So you don't have to keep locking it and unlocking it. It kind of just stays wherever you put it. So they'll get to where they want. And same thing, they're going to go in with the needle, drop the marker in, check it on the different views. And for this part, you're mostly just following the direction of the doctor on what side they want to see. Switching sagittal, axial, stepping in, stepping out, just confirming that the markers were placed. So this is pretty straightforward. You're just kind of providing imaging support, switching the views for them, helping them, navigate, left or right. And the key is, like I said, to make sure that they're inserting the needle off a midline. So whatever side they're trying to get on, if it's the left side of the patient, insert it left of the probe, so that sagittal crystal is pointing right to the needle, and they can see it a lot easier. If you insert on midline, you're going to go through urethra. So you don't want to do that. You want to be off urethra, which is usually midline. Remember, the probe is centered on midline, so you know where the urethra is. It's right above where the probe is. So that concludes the fiducial marker placement portion of the procedure.